appreciate your insurance IQ, how you keep yourself abreast, and I would love for you to just introduce yourself to the listeners, a little bit about who you are, a little bit about what you do, and a little bit about why I, who have spent 56 episodes convincing these people I know stuff about insurance, would say out loud, this guy knows something about insurance.
I appreciate that, Toby. Well, yeah, so I'm Mike Patton. I'm the CEO of XL Health Plans. We're a partially self-insured health plan, level funded and not level funded if you're a super large group or are interested in that. But really what we are is a conglomeration of what you would describe as point solutions prefabbed into a consistent recipe of cost containment, typically on PPO networks, mostly like the off-brand PPOs, your First Healths, your PHCS multi-plans, built around the concept.
But you call it off-brand, but also, I mean, that's UHC's network.
Exactly,
right?
So yeah, HealthSmart is UHC.
It's a pretty good network.
I like to use the brand, it's like Kirkland, where
yeah.
You know,
they're white labeling
because exactly, because you know, First Health is owned by Aetna,
right?
HealthSmart is owned by UHC, so they're like they're lower label brands, and for the listeners in health insurance, that doesn't mean, usually it means that they have access to all the same providers, but their discount off of billed charges is actually slightly
it's
worse.
Different, and we can talk about that.
Sure.
But the provider access points are
exactly, and that's the thesis on Excel, is that most of the plans and the easiest point of transition away from like the traditional health model is to make sure that access to providers is the same. Is when you move from like a Blue Cross to HealthSmart, you know, here in Los Angeles, you're not losing access to any providers. It's just a different logo on the corner of your car.
Yeah, so you tell your employee, you can still see Cedars.
You can still see Cedars, you can still see UCLA. Literally every freestanding hospital in LA is part of HealthSmart, and so are all the providers. So
and then to unpack for the listener, when you say we're a bunch of point solutions, what you're basically saying is, look, when we take a plan from a fully insured space to any version of self-funded, whether or not it's level funded, self-funded, however we shift claims liability, we have designed something to where the employer now has even more skin in the game with respect to claims dollars that go out the window. And so we can find these other vendors who come in these kind of surgical and specific places, kind of pardon the pun, to say from the overall claims that are unfolding, this pocket of claims we can make less expensive.
Exactly.
And another vendor says this pocket of claims we can make less expensive. And so you build out this ecosystem to say, Mr. and Mrs. Employer, take on the claims liability, and of course we'll write you stop loss to make sure no one claim blows up, no aggregate blows up, but within the respect of expected claims, we can push that down a little with this prescription.
Yeah, pretty much. And then the thing is that it's a consistent recipe of that. So that way, you know, probably the most difficult thing for the listeners to understand is underwriting that is the trickiest portion. You know, if you go to any random stop loss carrier as a benefits consultant and say, hey, here's all the things that I'm going to do, give me a 20% discount. If you're using one of those PPO networks, they're not likely to give you that full 20% discount up front. So what we've done with our data and our track record is, you know, we've been able to prove out with our volume over the course of the last, 24, 36 months that this plan design yields this result.
Right.
And that's allowed us to get preferential pricing with underwriters, and so we can pass that along to the employer group up front so they can see that savings up front in the initial RFP.
And some of the types of examples of this might be, see the same surgeon you want to see. Get the same surgery you were going to get.
Yep.
But rather than doing it in a hospital setting, can we talk to you about why you might want to do it in a different setting? And maybe not even can we talk to you, but can we, A, literally talk to you, like some outreach, but B, maybe change your member responsibilities, right? Maybe you do have a deductible here, you don't have a deductible there. That type of steerage is something, we talked a little bit offline, but you've seen some success with.
Yeah, exactly. And that is our primary prognosis, and how we advocate for all of those solutions is we offer them up to the member for free. So the member waives all cost sharing responsibility. And this is the larger ticket items like your surgeries, cancer care, but it's also small ticket items like imaging, which we all know can be pretty expensive, or is actually very affordable if you go to the outpatient imaging centers. So we waive that cost, or even things as small as lab work.
Right.
You know, lab work is also home to a lot of upcharging, and so, you know, we have a direct agreement with Quest, which is, you know, UHC operates the exact same fashion. You have to work through LabCorp with UHC, and you have to bill LabCorp. Even if you go to a provider's office, they don't allow the provider to upcharge it. They use UHC's direct pricing with LabCorp. It's really the exact same thing that we've got with Quest. So, you know, if you go into your provider, they bill Quest direct. You don't even have to pay anything for that lab, or you can go into Quest directly yourself and do it. So it's pretty simple on the members' end, but yields some pretty significant savings for employers, and also reduces the employees' personal out-of-pocket exposure.
And honestly, I might get the sense some employees, they might not necessarily care. Same surgeon, same surgery, hospital or outpatient, like, fine, whatever. You send me wherever, I'm just going to go there, right? I mean,
well, and usually, as you know, as a broker, most employees, there's like 1 to 2 providers that they care a lot about.
Right.
You know, like obviously, like OBs are probably, or pediatricians. I feel like those are the 2 ones that we get the most requests for. Oh, I have this person specific, and they need to be in the plan. I mean, surgeons are pretty unusual, where someone's like, oh, I have it.
I really want my colectomy done by this guy.
Well, yeah, and also surgeries are like an as-needed event, right? So if you need a surgery, you would go find a surgeon. After that, it's out of sight, out of mind again. Yep. So usually on an ongoing basis, you're not in need of a surgeon per se.
And we talked to Becca, your colleague, a little bit earlier about an event you guys have coming up, specifically this one on July 25th in Marina Del Rey. But can you talk to me a little bit about that?
Yeah, so it's a really awesome event where we're just going to talk about innovation in health plans and where things are headed, and just so employers are aware of how benefits are changing for their employees and how they can change really for the better to help them combat the effects of all the inflation in healthcare and how that affects them. Obviously, it affects their ability to continue to compensate the employees. It affects the out-of-pocket costs that the employees are there. So we're going to discuss trends in that and what brokers and employers are doing and innovative ways to help provide some solutions. So it'll give employers a really unique way to think about where are our health plans going and what can we do about them. And you can have some fun. We'll have some drinks up on a nice rooftop in Marina Del Rey, so that won't be too bad.
Maybe take a look at a facility.
Exactly, yeah, we're going to show you the building. It's an immaculate facility, so it'll be really cool to check out. And you guys will see like the type of spot where the $0 care comes from, and how awesome an environment it is, and how high quality the surgeons are. So we'll have all the surgeons present.
Love that, man. Well, I appreciate you coming out. We appreciate everything you guys are doing at Excel Health. And if you'll have me, I'd love to have you out on a full podcast. We'll do a whole episode and we'll dive deep, man.
Dive deep. Well, appreciate that,
Toby.
Thank you.